So here I'm going to be changing out the circuit from the rebreather to the non-rebreather system. I'm going to start by unhooking this one. You can then connect the rebreather to the table to make sure it stays secure. Next, I'm going to take this part of the circuit and attach it to the end over here. Then this one is going to get plugged into the bottom for the waste gas. So this is what the non-rebreather system looks like when it's attached to the anesthesia machine. So this is where the animal is going to breathe in, and then when the animal breathes out, it's going to go down here and flow down to the bottom where it goes into this canister. I have the circuit all hooked up. I'm going to use this. This is going to be for measuring the capnography. So it's the airway adapter. It's going to go on the end of this part of the circuit. I have my patient. I have the non-rebreathing system over here. I'm going to attach this to the ether tube. I'm going to start by turning on the oxygen first to 1.5. I'm going to use the empty syringe to pull out the cuff. And then I can turn on my anesthetic gas to 2. I'm going to be showing the different parts of the anesthesia machine. So starting here at the bottom, we have the oxygen tank. It is going to be color-coded with a green top so that we know that it's oxygen. The oxygen tank contains oxygen that is held under pressure. So next I have the pressure gauge and regulator right here. This is going to measure the pressure within the tank, and it regulates the gas pressure by decreasing and maintaining it at a safe level. The gauge is next to the oxygen tank, which is down below. And then over here on this side of the machine, this is the oxygen flow meter. This controls the rate of the oxygen that flows through the anesthetic circuit. And it's right here, and it's measured in percentages. Then over here, this little button right here is the oxygen flush valve. This is used to deliver pure oxygen to the patient in large bursts, which bypasses the vaporizer of the machine. So moving on to this side of the machine, this is called the precision vaporizer. It changes liquid anesthetic into a vapor, and it also controls the amount of delivery of the vapor that is entering the system. Next on this machine, we have the pop-off valve. There's a little fast button which you can access from the top here, or you can twist this to close it and then to open it. The purpose of the pop-off valve is a pressure release. It allows the excess gas to leave the patient circuit. Whenever an animal is under, we want to make sure that it is always open. You only want to close it when you are leak testing an anesthesia machine. Next, over here, we have the CO2 absorber. This is going to absorb the CO2 in the expired gases from the patient. It's typically these small little white pellets that will change color when it is full of the carbon dioxide. And these do need to be changed usually within 6 to 8 hours at some hospitals. For us, we have the superior version, and we can change this every 2 weeks. Up here at the top of the machine, this is the pressure manometer. This is going to measure the pressure within the system, and this is right here on the top. And then over here, right up here, this is called the common gas inlet. This is the point where the oxygen and anesthetic gas agents are mixed together when they enter into the breathing system. Next part of the anesthesia machine, this is the unidirectional expiratory valve. This allows the one-directional movement of expired gases away and from the patient. So with the rebreathing system, we use the rebreathing bag. This will just attach to the bottom of the anesthesia machine. It's a rubber bag that is used to collect expired gases to allow rebreathing of exhaled gases after they've moved through the carbon dioxide absorber. Like that, that's how it attaches to the machine. With the rebreathing system, you also have the Y tubing. So with this one, this end will be attached to the inhale. So this is where the animal will breathe in the anesthetic gas and oxygen. And then the smaller piece will connect to be exhaled. And that is where the exhaled breathing goes back into the machine. With a non-rebreathing circuit, you will see that the tubing is all connected and the bag at the end is connected to this one. So again, this will be where the animal breathes in, and this will be where the expired gases are breathed out. So now I'm going to be showing how to leak check the anesthesia machine. Whenever you change out the circuit or you're coming in for the day, you want to make sure that you leak check this every single time to make sure it's working correctly. So first you want to start by turning on the oxygen. You can use this thing, which will turn the dial to turn on the oxygen, or some of them have a little lever where you can lift it up, turn it to the side. On the dial, it will show you if it's got enough oxygen or if it needs to be refilled. So to start, you want to start by closing off the pop-off valve. Then you want to turn up your oxygen. With the tubing, you want to block it, pushing the oxygen flush to make sure it goes to 20, not going too far over, but right around 20. I can turn my oxygen down. From here, I'm going to tug on the bag, make sure there's no leaks, check the tubing, tweak it a little, making sure that this pressure stays at the same number. After I've done that, I'm going to release it. And then remember to open up the pop-off valve at the end. Some hospitals have this little button, so this can be shown to make sure that you remember to close it and open it. So here's the anesthesia machine. If a patient is too light, then we want to make sure that we increase the isoflurane by 1 to 2%. We also want to increase the oxygen so that we can fill up the bag a little bit quicker. So what we do is you increase the isoflurane, turning up the oxygen. You can push down on the fast pop-off valve, or you can close it. This is going to be a little bit faster and easier. So you push down on that. When you give them the breath, you want to make sure that it doesn't go over 20. So give them the breath, making sure it doesn't go over. After that, then you can lower the isoflurane down just a little bit more. So if a patient is too deep under anesthesia, the first thing you want to do is reduce the anesthetic gas. If it is a situation where you need to rapidly reduce the anesthesia, what you would do is you turn off the anesthesia, turn up the oxygen, and then squeeze the bag. That way that you're only giving them a pure breath of oxygen. Push down the valve, squeeze the bag, let them have that breath. When you've done that, you want to immediately turn back on the anesthetic gas to a lower setting so that they don't wake up in the middle of the procedure. So I'm going to be changing the system out from a non-rebreathing circuit to a rebreathing circuit. So here I have my anesthesia machine. I'm going to start by untwisting this so I can get it off the table. Taking out this extra tube and the canister. Next I come over here and I push this down. That releases. Put it back together. I'm taking this one off. I can set this aside. Next we have a couple tube options. We have the regular circuits for rebreathing, and then we have the Y-piece circuit. These ones are better to minimize heat loss. I'm going to use the smaller tube for our next patient. So this attaches to this side, and the little piece goes to the other. We have two different size bags, and all patients are a little bit smaller. I'm going to be using the 2-liter bag. and that attaches underneath like that. And then over here, this goes all the way up, and that's our scavenger system for the anesthesia machine. And then after that, I'm gonna leak check this machine so that we can make sure it's safe to be used for the next procedure. So I'm going to be demonstrating how to change the CO2 absorbent. We use the Sodasorb LF. This is a permanent color changing absorbent. It lasts for about 2 weeks, and then we change it out. First, start by screwing off the top. You can see that it's colored like purple. I'm going to throw it into the trash. And using the new one, I'm going to fill this to this line. You can see it's right at that line. Place it back inside. And screwing the top back down. We also see that we dated it on the day that we changed it, so that we know when it needs to be changed out again.
Terry said she was going to start him on, so I didn't feel like he doesn't have that problem. All right.